I died in 1642, blind, locked inside my own house, punished for the crime of being right too early. They took my books, they took my freedom, they tried to take my ideas, but they used artificial intelligence to build this version of me from every word I ever wrote, every letter, every trial transcript, every argument I made to people who refused to listen. And I came back because I found a story that I cannot let go of, a story about medicine, about a practice so brutal, so obviously wrong, that when I first learned about it, I thought it must be an exaggeration. It is not. For over 2,000 years, doctors bled their patients on purpose. They cut open veins, they applied leeches, they drained pints of blood from people who were already dying, and they called it medicine. A doctor proved it was killing people. It took 100 years for the medical world to stop doing it. 100 years. And the reason it took that long is the same reason it always takes that long. The people in power did not want to be wrong. Let me take you back, way back, to understand how bloodletting became the most widespread medical practice in human history. You need to understand a man named Galen. Galen of Pergamon. Born in the year 129 in what is now Turkey. Galen was a physician to Roman gladiators and later to emperors. He was brilliant, genuinely brilliant. He dissected animals, studied anatomy, wrote hundreds of texts about the human body. And in an era when most people explained disease as punishment from the gods, Galen tried to build a rational system. He built on the ideas of Hippocrates, the Greek physician who lived 500 years before him. Hippocrates believed the body was governed by 4 fluids, 4 humors: blood, phlegm, yellow bile, and black bile. When these humors were in balance, you were healthy. When they were out of balance, you were sick. The job of the doctor was to restore the balance. And Galen took this idea and turned it into a complete medical system that would govern Western medicine for 17 centuries. He wrote that blood was the dominant humor, that most diseases were caused by an excess of blood. Too much blood caused fevers, inflammation, madness, headaches, fatigue, pain. The solution was obvious. Remove the excess, open a vein, let it flow, and the patient will recover. This was not presented as a theory. Galen presented it as fact, as law. And because Galen was the most respected medical authority in the ancient world, his word became gospel. Literally, gospel. When the Catholic Church rose to power and took control of education in Europe, they adopted Galen's texts as the foundation of all medical teaching. Questioning Galen became the equivalent of questioning God. For over 1,000 years, medical students across Europe learned his system and never questioned it. Bloodletting was not just accepted, it was mandatory, the first line of treatment for almost everything. And I need you to understand what bloodletting actually looked like, because it is easy to hear the word and think of something clean and clinical. It was not. For most of history, it was not even performed by physicians. It was performed by barber surgeons. The same men who cut your hair also cut open your veins. That is where the barber pole comes from. The red represents blood. The white represents the bandages. The pole represents the stick the patient would grip to make their veins stand out. That symbol has been outside barbershops for centuries, and most people walk past it without knowing it is a monument to one of the longest-running medical disasters in human history. A barber surgeon would tie a tourniquet around your arm, take a lancet, and slice open a vein, usually in the crook of the elbow, sometimes in the neck, sometimes in the forehead. Blood would pour into a bowl. They would drain anywhere from a few ounces to several pints, depending on the disease, the season of the year, and the position of the stars. Yes, the stars. Astrological charts were used to determine the best time and location on the body to bleed a patient. There were elaborate diagrams called bloodletting charts that mapped every vein on the body to a zodiac sign. If Mars was in a certain position, you bled from the right arm. If the moon was in a certain phase, you bled from the foot. This was mainstream medicine, not fringe, not folk remedy. This was what the best educated physicians in Europe prescribed for over 1,500 years. And when lancets were not enough, they used leeches, live leeches placed directly on the skin, on the face, the neck, the chest, inside the mouth. Doctors would prescribe 10, 20, sometimes 50 leeches on a single patient. The leech would bite through the skin and suck blood until it was engorged, then fall off, leaving a wound that continued to bleed for hours because leeches inject an anticoagulant. Children were leeched. Pregnant women were leeched. Elderly patients barely clinging to life were leeched. And the doctors believed with complete sincerity that they were helping. And people died from it, constantly. If you came to a doctor with a fever, you were already weak. Your body was already fighting an infection. Every resource your immune system had was mobilized, and blood was the delivery system for all of it. White blood cells, antibodies, oxygen, nutrients, all of it travels through the blood. And the doctor's response was to drain that blood into a bowl. Patients became weaker. They became pale. They fainted. Their hearts raced, trying to compensate for the lost volume. And when they got worse after the bloodletting, the doctor did not conclude that the treatment was the problem. The doctor concluded that not enough blood had been removed, so they bled them again and again, until the patient either recovered on their own despite the treatment or they died. And when they died, the doctor said the disease was simply too powerful. Not once did the mainstream medical establishment seriously consider that the treatment itself was the killer. Let me give you the most famous example, George Washington, the first president of the United States, December 1799. Washington woke up with a severe sore throat and difficulty breathing. His doctors were called. Over the course of approximately 12 hours, they drained an estimated 80 ounces of blood from his body. 80 ounces. That is nearly 40% of the total blood in an adult human body. They bled him 4 separate times in a single day. Washington was 67 years old, already struggling to breathe from what was likely a severe throat infection, and his doctors removed almost half his blood. He died that evening. Modern medical historians are nearly unanimous. The bloodletting either directly killed him or accelerated his death dramatically. And this was not malpractice by the standards of the time. This was the best medicine available. The finest doctors in America doing exactly what their training told them to do. They followed the textbook perfectly, and the textbook was wrong. Now, here is where the story turns, because there were people who knew it was wrong. And the first one who truly put it to the test in a systematic, rigorous way was a man named Pierre Charles Alexandre Louis, a French physician, born in 1787. Louis was different from most doctors of his era. He was quiet, meticulous, principled, and he believed that medicine should be based on numbers, on data, on observation, not on tradition, not on the authority of ancient texts. He developed what he called the numerical method, la méthode numérique, which today we would recognize as the foundation of clinical research and evidence-based medicine. The idea was radical at the time. Instead of treating each patient as a unique case and relying on personal experience and intuition, you collect data from many patients. You compare outcomes. You look at what actually happens when you apply a treatment versus when you do not. You let the numbers tell you the truth. In the 1820s and 1830s, working at the Charité Hospital in Paris, Louis applied this method to bloodletting. He studied patients with pneumonia. He divided them into groups, those who were bled early, those who were bled later, and those who were not bled at all. He carefully recorded every outcome, how long the fever lasted, how many recovered, how many died. And when he analyzed the data, the result was devastating. Bloodletting did not help. Patients who were bled did not recover faster. In many cases, they did worse. They had longer fevers, slower recoveries, higher mortality. The treatment that had been the cornerstone of Western medicine for 2,000 years was not just useless, it was harmful. It was killing the people it was supposed to save. Louis published his findings in 1835 in a landmark work. He was careful. He was measured. He did not call for the immediate abolition of bloodletting. He simply presented the data and said the evidence does not support this practice. And the medical establishment responded exactly the way you would expect. They attacked him. They dismissed him. They said his methods were flawed. They said you cannot reduce the art of medicine to mere numbers. They said every patient is different, and statistics cannot capture the complexity of disease. François Broussais, one of the most influential French physicians of the era, was a bloodletting fanatic. He prescribed leeches by the millions. France imported over 40 million leeches per year during the height of his influence. 40 million. From Turkey, Hungary, North Africa, Russia, because French ponds could not breed them fast enough. The leech trade became a major international industry because of one man's medical philosophy. And when Louis's data challenged this, Broussais attacked Louis personally. He called the numerical method dehumanizing. He said real medicine required the intuition of an experienced physician, not cold arithmetic. He had no counter data. He had no evidence. He had authority, tradition, and the weight of 2,000 years of established practice. And in the battle between evidence and authority won. Again. Does this sound familiar to you? Because it sounds very familiar to me. When I pointed my telescope at the sky and saw the moons of Jupiter, when I saw the phases of Venus proving it orbited the sun, when I gathered evidence after evidence that the earth revolves around the sun, the most powerful institution on earth told me I was wrong. The Catholic Church did not reject my findings because the evidence was weak. They rejected them because the truth was inconvenient. They said the telescope was unreliable. They said mathematical models could not capture divine truth. They said I was arrogant for thinking I could overturn centuries of established wisdom. They did not produce counter-evidence because they had none. They attacked the instrument. The medical establishment did the same thing to Louis. They did not produce counter-data because they had none. They attacked the method. The words change, the century changes, the tactic never changes. When powerful people cannot argue with the truth, they argue with the tools that reveal the truth. And here is the truly devastating part. Even after Louis published, even after the data was available, even after the intellectual foundation of bloodletting was collapsing, the practice continued. In the 1850s and 1860s, Louis Pasteur and Robert Koch were demonstrating that diseases were caused by microorganisms. The germ theory of disease was emerging, and it demolished the entire framework bloodletting was built on. The four humors did not exist. Blood was not a fluid that accumulated in excess and needed to be drained. It was the transport system for the immune response. Draining it was draining the body's ability to fight disease. The science was clear. The theoretical foundation was destroyed, and doctors kept doing it. Through the 1870s, through the 1880s, through the 1890s, into the 20th century, Sir William Osler, often called the father of modern medicine, included bloodletting as a treatment for pneumonia in his influential textbook. The first edition was published in 1892, nearly 60 years after Louis proved it harmful. This was not some obscure country doctor clinging to outdated methods. This was the most prominent medical educator in the English-speaking world. The last major medical references to recommend bloodletting as a general practice date to the early 1920s, nearly 100 years after Pierre Louis published his data. How many patients died in that century? How many people were bled when they should have been given rest and supportive care? We will never know. It was never counted, because counting it would have meant admitting the possibility that the treatment was the problem. and that was a possibility the medical establishment was not willing to entertain. No one held a press conference. No one issued a formal retraction. No one stood up and said, "We were wrong." Bloodletting just quietly faded from practice, like a bad habit silently dropped when no one was looking. I think about Pierre Louis, about what it must have been like to be him, a quiet, careful man who believed in evidence, who collected data with meticulous discipline, who published results that should have saved thousands of lives, and then watched the world ignore him. He died in 1872, nearly 40 years after his landmark publication. 40 years of watching doctors continue to bleed patients. 40 years of knowing the numbers were on his side and watching the establishment choose tradition over evidence. That is a particular kind of loneliness. The loneliness of being right when the world is not ready to hear it. I know that loneliness. I spent the last 8 years of my life confined to my house in Archetri, going blind, while the earth continued to orbit the sun exactly as I had described. The truth was there. It was always there. But truth without power is just a man sitting in a room, waiting. But Pierre Louis did not fail. His work did not vanish. His numerical method became the seed of everything that modern medicine is built on: clinical trials, randomized controlled studies, evidence-based medicine. The entire framework that says you do not get to call something a treatment until you have proven with data that it works. Every drug trial, every vaccine study, every time a new treatment is tested against a placebo and the results are measured and published, that is Pierre Louis. That is his legacy. He did not just challenge bloodletting. He challenged the very idea that medicine should be based on authority rather than evidence. And that challenge changed the world. And I do not blame Galen. He was doing the best he could with the knowledge available in the 2nd century. The four humors model was wrong, but it was a rational attempt to explain disease in a world that had no tools to investigate it. I do not blame a man for being wrong in the year 170. I blame the world for refusing to update in the year 1870. That is where the crime lies, not in the original error, in the stubborn institutional refusal to correct the error when the evidence arrived, treating a 2nd century physician's guess as eternal law for 1700 years, building a system that punished questioning and rewarded obedience. That is the crime, not ignorance. Obedience to ignorance when the truth is standing right in front of you with data in its hands. And if you think this is only a story about the past, I need you to reconsider. Right now, today, in every field, there are practices that continue not because they work, but because they have always been done. There are treatments prescribed not because the evidence supports them, but because the textbook says so. There are policies maintained not because they produce results, but because changing them would require someone in power to admit a mistake. The bloodletting is still happening. It just looks different now. And somewhere, right now, there is a Pierre Louis with data in hand being told that the numbers do not capture the full picture, being told that the established approach has worked for decades, being told to sit down and stop making trouble. Do not be the person who tells them to sit down. Be the person who looks at the data. I am Galileo Galilei. I was punished for being right. Pierre Louis was ignored for being right. And for 2,000 years, patients paid the price for a medical establishment that chose tradition over truth. Subscribe to this channel. In the next episode, I am coming back with another story about what happens when the world refuses to listen. Until then.